Hi everyone, I'm Dr. Rakesh here. So I'm a critical care specialist, anesthesiologist, and an ECMO physician who has got around 10 years of experience in this field. So I'm presently working in Hyderabad, LB Nagar, NASA hospitals. So presently I'm have designation of clinical director for these departments. So next few minutes I am going to talk regarding the most common conditions. Generally, the most common complication which we generally face in our critical care unit or in our anesthesia department, but is also the most commonly neglected topic to discuss also because people does not know the importance of this topic. So I'm going to speak about hypothermia and its importance, how to maintain or how to treat these hypothermia patients inside your ICU, or how to prevent this hypothermia to develop in my patients who are in either an ICU or whether they're in operation theatre now. So let's go back and see what does exactly mean, what are the risk factors involved, how to treat it, what are the newer treatment modalities available, and how to overcome this most common problem which we generally face in a routine ICU practice. So as we all know, hypothermia means it is defined as a core temperature less than 35 degrees centigrade and is frequently most commonly overlooked problem as I am telling here. So what are the most common causes you do have? You do have prolonged surgical exposures, any surgery lasting for more than 2-3 hours of durations, and surgeries requiring massive fluid transfusions, like say for example TURP surgeries, PCNL surgeries, especially urology surgeries, where they'll flood the patients with lot amount of fluids here. Infections. The most common cause is again infection. As you all think that fever is the most common sign of infection, but remember guys, any patient who is having infections with hypothermia, that's going to the worst prognostic sign. Massive transfusions, whether it's a blood transfusions or fluid transfusions or crystalloids, severe trauma-related blood losses. So when there's a lot of blood loss in those situations also, you'll face a lot of hypothermia also. In ICU settings, patients particularly vulnerable mainly because of immobilizations, because you do sedate and paralyze the patients as you have most of ARDS clientele. So you have to sedate and paralyze them for maintaining the vitals. And we do maintain the environmental cooling. Maintaining the room temperature of 24 degrees is vital for so many other parameters to function in ICU. So as you see, these patients, if they're conscious enough, they can have mild symptoms like confusion or lethargy, but they might transfer into severe symptoms or they might transfer into life-threatening symptoms like bradycardia, hypotension, and if neglected, sometimes cardiac arrest too. So these are the basics of hypothermia.